As I was speaking in my session as well, change management is one important thing everybody has to ace. So we are dealing with a multi-talented group of stakeholders. So all these stakeholders have to come together. Each of them have their own experiences, their own pitfalls. It's about how do we drive the team together? How do we propel them forward with a unified thought of the change? So digital transformation happens with that. And also, again, in India, one other bigger problem is we have tons and tons of data. And as I said earlier, structured data is the problem. We have paper data to digitization, digitization to digitalization, and from digitalization to leveraging these digital documents and getting value out of it. The value creation is wherein the digital transformation truly happens. So these are the big challenges and the mitigations. The mitigation is just to work together as a team, understand what is the right fit, know what is the real baseline problem, get your problem statement right, and half your thing is done with that, and take it to the community with all the last mile connectivity. So these things would definitely transform the way we are working, and Admire is going to work on that. Thank you.
ನಮ್ಮ ದೇಶದಲ್ಲಿ ಅಧಿಕ ಜನಸಂಖ್ಯೆ ಇದ್ದಾಗಲೂ ನಮ್ಮಲ್ಲಿರ್ತಕ್ಕಂಥ ಒಂದು ವೈದ್ಯರ ಒಂದು ಸಂಖ್ಯೆ ಮತ್ತು ಸಂಘ ಸಂಸ್ಥೆಗಳು ಅಂದರೆ ವೈದ್ಯಕೀಯ ಸಂಘ ಸಂಸ್ಥೆಗಳ ಸಂಖ್ಯೆ ಕೂಡ ಭಾಳ ಕಡಿಮೆ ಇದೆ. ನಾವು ಪಾಪ್ಯುಲೇಷನ್ ಕಡಿಮೆ ಮಾಡೋಕ್ಕಾಗಲ್ಲ, ಸಂಸ್ಥೆಗಳನ್ನ ಮತ್ತು ವೈದ್ಯರನ್ನ ನರ್ಸ್ಗಳನ್ನ ನೀವು ಸಡನ್ನಾಗಿ ಹೆಚ್ಚಿಗೆನೂ ಮಾಡೋಕ್ಕಲ್ಲ. ಅಂತಹ ಸಮಯದಲ್ಲಿ ಭಾಳ ಮುಖ್ಯವಾಗಿರ್ತಕ್ಕಂಥದ್ದು ತಾಂತ್ರಿಕತೆ, ಅಂದರೆ ಡಿಜಿಟೈಸೇಷನ್, ಕಂಪ್ಯೂಟರೈಸೇಷನ್ ಅಂತ ಏನು ಹೇಳ್ತೀವಲ್ಲ ಅದು. ಇದರ ತನಕ ನಾವು ನೋಡ್ತಕ್ಕಂಥ ಕಂಪ್ಯೂಟರೈಸೇಷನ್ ಏನು ಮಾಡ್ತಾ ಇದ್ದೀವಿ ಅಂದರೆ, ಈ ವೈದ್ಯಕೀಯ ಕ್ಷೇತ್ರದಲ್ಲಿ ಅಥವಾ ಹೆಲ್ತ್ ಕ್ಷೇತ್ರದಲ್ಲಿ ನಾವು ಹಾಸ್ಪಿಟ್ಲ್ಗಳಲ್ಲಿ, ಆಸ್ಪತ್ರೆಗಳಲ್ಲಿ ಮತ್ತು ಕ್ಲಿನಿಕ್ಗಳಲ್ಲಿ ಆಗತಕ್ಕಂಥ ಪ್ರೋಸೆಸ್ ಮಾತ್ರ ನಾವು ಡಿಜಿಟೈಸ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಅದು ನಮ್ಮನ್ನು ಸ್ವಲ್ಪ ದೂರ ಕರ್ಕೊಂಡು ಹೋಗುತ್ತೆ ಹೊರತು ಅದು ಮುಂದಿನ ಹೆಚ್ಚಿನ ರೀತಿಯಲ್ಲಿ ನಡೆಯೋದಿಲ್ಲ.
First of all, I want to congratulate IIHMR Bangalore to have taken this leading step in trying to train the hospital managers and everybody in digital technology, and to also understand the entire digital health ecosystem and to see what is the role of teaching institutes like IIHMR in making that ecosystem robust by creating the right kind of managers and the right kind of people who are, and the programs which are required for it. Not many people in India have thought about it as yet, whereas our politicians and bureaucrats want us to have a very robust digital ecosystem so that every citizen in India can be empowered with the power of digital technology and to manage their own healthcare. But to create that, we need to have a lot of programs that need to come together, which is an integration of capacity building and also use of technology. And IIHMR, through this program on Admire, as well as the new training initiatives in digital transformation for healthcare providers, is trying to fill in that gap and make sure that these programs for the Government of India can be successful.
Today, this morning, we launched a path-breaking symposium on digital health care. And the whole idea of this is that the healthcare and hospital care is going through transformation. And now this is more so to digital technology. So what we plan now to improve availability, accessibility, utilization of healthcare, and cost reduction and quality improvement, we have to adopt digital technologies. But in between the healthcare professionals and information technology industry, there is a lot of gaps, there are a lot of distances. So we need, the first thing is that we need to bridge those gaps, that we as health professionals understand the applications of technology, and technology people understand what is healthcare and how it is being provided. What we plan now, how this digital technology can be applied in healthcare. The idea is, how can we improve the health of the people through effective and easy applications and reaching out. Problem is not that the healthcare is not available. Problem is how to reach out. We all are reluctant to reach. So how can we enable people to reach or access healthcare? So we are going to start with this symposium or launch a program, academic executive education program on digital healthcare management, digital technology healthcare management at the IIHMR Bangalore. And this will be mainly healthcare professionals and IT industry professionals. And the whole purpose is to build capacity, give training to healthcare professionals, research, promoting startups in health technology applications and development, design thinking, how can we move further. The whole idea is how the future is digital technology in healthcare. And this symposium should be the launch point for this transformation that we are aiming at. We have done it with hospital and health management. In 1996, we started first program on hospital and health management, MBA program or postgraduate program. And it has taken now about 25 years, but it has transformed management practices in healthcare and hospitals. We trust that it has taken 25 years, it should not take more than 5 years in digital health transformation. And our efforts will be into how digital technology can be developed and used in healthcare.
My name is Usha Manjunath. I'm the Director of Institute of Health Management Research, Bangalore. We're very happy today to be launching ADMIRE, the Center for Advancing Digital Health Management, Innovation, Research and Entrepreneurship. This is a great opportunity for us in the midst of Dr. Randeep D, Health Commissioner, as the chief guest, Dr. S.D. Gupta, our Trustee Secretary, Professor Shedgopan sir, and Dr. Kedar sir. So this has been a great opportunity for us in the midst of many hospitals, administrators, many of the senior people in the audience, and a lot of activities are planned for this in terms of discussion, where how digital health is taking shape in India, how we are going to move forward, and what is happening in the innovation sector. So ADMIRE plans to really create a great platform for startups to look at healthcare data, to look at ethical clearances, as well as analysis and support startups in the healthcare space. The exhibition and the startup exhibition was appreciated by everyone. There are many products, new ideas, including our IIHMR students have put up, how a particular platform can be created using open source. So this has been a great occasion. We are also coming up with an executive program for digital hospital and digital health management, and that's also been launched now. And so we are moving ahead with this AIHMR program into the space of digital health, upskilling, skilling, and various aspects of preparing the personnel to really come into the reality of harnessing the digital health movement that is happening. And in the how do we really do it? We would like to do it with a lot of simulation center experiential ones, so that the learning happens faster, very well, and into, of course, research aspects, as well as dissemination of information. Thank you all. It has been a great opportunity and a platform that we have created.
Be a part of digital symposium and also see the launch of Aspire. I've been associated with IIHMR from 1984 when it was started. I distinctly remember Dr. Agarwal coming to our hospital in Koa Medical Center, and he was talking about establishing Indian Institute of Health Management Research, which will be in par with IIM Ahmedabad or Bangalore for healthcare. And believe me, after about 25 or 30 years, it has really happened. I am very happy about it. And I've been a part of IIHMR Jaipur. I was on the advisory board, and I was also on the advisory board of Bangalore when it was started. And I have been getting students from IIHMR as interns, and they have been great interns. They have done great work in our hospitals. I have trained them. And in fact, many of the students who come here come with me for project. They do project, and they got selected for some of the best projects in CAVO conference. And even now, today, Swashai has made a presentation about the IoT project which he did in our hospital. And when I was invited for this digital symposium, I was very happy, and I thought it was a great privilege to come again to this institute. And I'm supposed to talk in the afternoon in the panel. And I also saw that another organization called Aspire is being launched today. I think that's a great forum for all the entrepreneurs, all the faculty, and it's a great interaction between academia and industry. And I wish them all very well. And I have found IIHMR as an institution very good, very ethical, and the students are brilliant students. And given a choice, if I have to select from 10 institutions, I will vote for IIHMR. Okay.
It's a pleasure to be here at IIHMR Bangalore for this digital health symposium. Admire, we are looking to take on the world with this, together with the students who would be at the forefront, who would be driving the marriage between digital and health and care. Lakshmi, Saraswati, and Parvati, as beautifully said by Professor Sadagopan. We are really looking forward to bring in this new oil, which is called data, rather I would say structured data, which is going to drive this whole digital healthcare forward. So I'm really privileged to be amongst the doyens in healthcare as one of the speakers, and inspiring the young students as well. Thank you, IIHMR, for this opportunity.